Hello everyone. Today's video is about a case of pandas that I've been working with recently, and we're having some really great success, and just wanted to post a little success story on here because man oh man, pandas is just such a challenging, heart-wrenching, sometimes really just devastating condition. And so just wanted to post this as kind of a feel-good story, and hopefully it's helpful to hear about this, if pandas is a condition that's affecting your family in some way, shape, or form right now. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So yeah, this patient, I started working with her and her family maybe 6 months ago or so, give or take. I think she's 8 or 9 years old, and yeah, just basically classic pandas history. Had an episode of strep, strep throat. Then shortly after that, within a couple of days, started developing some really notable personality changes. A lot of OCD behaviors. Didn't ever want to be alone. Just really like super clingy to mom and or dad. Became really anxious about things, and then started developing a lot of food aversions. So it was basically refusing to eat meat, refusing to eat anything that was salty, and yeah, basically just was not able to go to school. Really challenging situation. So fortunately, the mom and dad, like, there's very on top of things. They were right away, like, started doing some research, brought in the family doctor. Family doctor didn't know what was going on, kind of referred off to the pediatrician. But they, the parents started doing their homework right away, and like right away came across information about PANS and PANDAS. So talked to their doctor about this, and thankfully their doctor was like, yeah, sure, like, I'll prescribe some antibiotics. And anyways, got on some antibiotics, which was helpful, helped to stabilize things, but like things were still really pretty up and down. We ended up getting prescribed some antipsychotic medication to help to sort of tone down some of the behaviors, because there started to be a worsening of some of the food aversion. There started to be like kind of some threatened like fluid intake aversion, and so anyways, went on some antipsychotic medication that seemed to help, but then it was causing a bunch of side effects as well, unfortunately. So that's basically what the playing field was like. So they were maybe 2 months in or so when they booked an appointment with me, and so we basically had a conversation about just looking at things more, a little bit more holistically. Antibiotics, great, and sometimes they're going to help really quickly, but in this case, that did not seem to be the case. They're helpful, but not knocking it out of knocking it out of the park, ASAP. And then, of course, with the antipsychotic, that's fine as a Band-Aid solution, and it seemed to be helping to some extent, but they wanted to get her off of that lickety split because they were noticing some notable side effects, like quite a lot of weight gain and some personality change and things like that. So anyways, we started working with some Chinese skullcap. Chinese skullcap is a herb that I use all the time with my patients with a PANS or PANDAS diagnosis. I can't remember if I learned about it from Dr. Jill Krista, who's an expert in the PANS PANDAS world. She wrote a book a few years ago called A Light in the Dark for PANS and PANDAS. I actually recently interviewed her for my podcast, the Overcoming Chronic Illness podcast. Haven't posted the episode yet, but that should be coming out within the next few weeks or so. And anyway, she's a great resource. Her book's amazing. So anyways, she talks about Chinese skullcap all the time. Chinese skullcap has antimicrobial activity, but it also has some really great immunomodulating activity and some anti-inflammatory activity, and is known to cross the blood-brain barrier. So it's a real great multitasker. With this patient, we also started working with, we started working with some Chinese skullcap, also started working with some quercetin as a supplement, so a mast cell stabilizer, and also some antihistamines as well, so just some over-the-counter antihistamines. I find that it's not something that I recommend for all of my patients with PANS and PANDAS, but with a number of them, I find that to be quite a helpful adjunct. Well, the patient was also taking ibuprofen as well. That was something that her parents had started her on prior to seeing me, which seemed to also be somewhat helpful. So we started on those things, and then my recommendation was that once those things were in place, like those new agents were in place, then I recommended that they start giving her something called low dose immunotherapy, or LDI, specifically for strep. So I've posted other videos about low dose immunotherapy before. I've posted about this specifically with respect to PANS and PANDAS, so please cross-reference that video if you're interested. Just search it up on my YouTube channel. I think the video is called something like a profound treatment for PANS and PANDAS or something like that, if you want to try keyword searching that. Low-dose immunotherapy was developed by a medical doctor down in the States called named Ty Vincent, and he has lots of videos on YouTube and other platforms, I'm sure, talking about this as well. But it can be a profound treatment for PANDAS and PANS, as the other video name suggests. So I recommended that after putting the patient on these interventions, the Chinese skull cap, the quercetin, the over-the-counter antihistamines, that they, give her a couple of weeks on those just to try to stabilize things more, and then start the low-dose immunotherapy. One of the only prerequisites, if you will, for starting low-dose immunotherapy is that we want the playing field to be fairly even keel before we start it, because we need to see, is the dosage helping, is it doing nothing, or is it actually causing things to flare up? Because if the dose is too high, it's going to cause a flare. If the dose is too low, it's not going to do anything. If the dose is just right, we're going to see a significant improvement, usually quite quickly. Long story short is they started her on the supplements, like on the quercetin, the Chinese skull cap, and the antihistamines. A couple of weeks later, sent me an email saying like things seem to be doing better, things seem to be more predictable, more stabilization. She was actually starting to accept some foods that she had previously not been accepting at all. So that was a good sign. And then they started her on the low-dose immunotherapy. So we followed up maybe 6 weeks later or so, give or take, have a check-in, and thankfully things were doing quite a bit better. More foods coming into the mix, less clingy behavior, started actually going back to school, which is really exciting, and not full days, but starting to go back for a couple of hours a day, and just less clinginess to mom and dad, and just fewer kind of notable reduction in anxiety. So they're like, wow, we're really feeling like she's coming back. And what was also really wonderful was that previously, even though the antibiotics had been helping, the antipsychotic had been helping, the ibuprofen had been helping, there were these episodes where she would just, for whatever reason, have a major flare up. So, she's doing having a pretty good day and then be an awful day, just randomly, maybe once or twice a week. So thankfully, after starting the protocol, the protocol that we implemented, then she wasn't having those, she had not had any terrible days within that 6-week period, which was really, really great. So I recommended, stay the course. Kind of the name of the game with treating PANS and PANDAS, in my opinion and in my experience, is that we want to keep that immunomodulation going as much as we can. Now, this family, ideally, they would have had easy access to IVIG therapy. We don't have easy access to IVIG therapy for the most part here in Canada, at least not in Atlantic, Canada, where I am. So they were on a long waiting list to see someone to talk about maybe bringing that in. So ideally we would have had that in the mix, but it was not an option at that point in time, anyways. So a treatment principle is to try to modulate the immune system as best we can, which can be helped by things like low-dose immunotherapy, Chinese skull cap, the quercetin. I think ibuprofen plays a role in that as well. Things like IVIG, there's other immunomodulator supports as well, things like N-acetylcysteine and certain other immunomodulating herbs, different medicinal mushrooms like reishi mushroom, different things like that. But we can only throw so many supplements, especially into kids, so they have trouble swallowing pills and things taste bad and all that. So we can usually get away with not throwing the kitchen sink at them. So we want to keep that immunomodulation going. We want to keep the neuroinflammation down as much as possible, and just to try to minimize symptoms as much as possible, and basically buy time so that we can try to recalibrate the immune system to stop being in a helter-skelter symptom-inducing mode. So with her, we just stayed the course. We modified the low-dose immunotherapy dose a little bit. We made it a bit stronger because like things were moving in the right direction nicely. But with LDI, when we have it tuned into the exact right dose, we can see like really fast improvements in many cases, in my experience. And so I thought, well, let's try turning it up a little bit, like turning up the intensity a little bit more, upping the potency a little bit more. So we did that, had a follow-up again about 6 weeks later, always telling the patients, parents, send me an email, let me know if anything comes up, this and that. But no news is good news. I didn't hear anything. And so 6 weeks later, she's doing markedly better. School's going very well now. A lot of the food aversions have really gone to the wayside. There's still a couple of foods that are still kind of like, they're just kind of they're not wanting to push it too fast. So there's still a couple of foods that are off the menu, but just doing so much better, like personalities, like back to normal, back to baseline, anxiety's down, like just, ballpark, I'd say like 90+% recovered at this point. Yeah, all signs of it being a successful case up to this point. Still not 100% out of the woods, but I think it's just going to take a little bit more time. We're tweaking the low-dose immunotherapy a little bit more, but we seem to really be on the right track. So very happy for the family, happy for the patient, and just wanted to share that story. The game plan at this point, again, is to tweak the low-dose immunotherapy a little bit more, continue to stay the course with other things. She's actually weaning off the antipsychotic, which is great. She's already in the process of doing that. It's going well. She's been off the antibiotics, still using ibuprofen, but at a lower dose. And so kind of the game plan is to ideally wait for things to get to 100%, make sure the tapering off the antipsychotic goes well, which I predict that it will. Then we'll get her off the ibuprofen, and then we'll start turning down lowering the dose of some of the other interventions, like some of the other supplements that we're working with right now, keeping up the low-dose immunotherapy probably for another good couple of months anyways, just to make sure that we've really solidified that immune system rebalancing as best as we can tell. So I'll leave it there for now. I hope this clinical anecdote was of interest. If anybody has any questions or comments on this, if you've used low-dose immunotherapy yourself, or for a family member, or any other comments about this, things that you found to be successful for your own child or family member with PANS or PANDAS, please feel free to post it in the comment section below. I know that folks post comments, they read the comments, they sometimes get conversation threads going in the comment section that have nothing to do with me. So just anything you feel comfortable sharing, please consider that. And otherwise, I will leave it there for now.